Today's episode of Rheg Explains.
Hello everyone! Welcome back to another episode of Rheg Explains. Hi, my name is Regine May Pagio, a third-year biology student. For today's discussion, we're gonna talk about one of the disorders of hormonal imbalance. Pheochromocytoma is a rare benign tumor that develops on the adrenal medulla that secretes excessive amounts of catecholamines. I know it's kind of confusing at the moment, so let us try to break it down. The human body has two adrenal glands. One is located at the top of each kidney. Our adrenal glands have two parts. The outer part is the adrenal cortex, and in the inside is the adrenal medulla. So the tumor develops in the adrenal medulla, usually on only one adrenal gland. But remember, tumors can develop in both. Inside the adrenal medulla are chromaffin cells, which are responsible for the secretion of catecholamines. To be specific, secretes the hormones epinephrine and norepinephrine, which trigger your body's fight or flight response to a perceived threat. These hormones cause your blood pressure to increase and your heart to beat faster. They prepare other body systems that enable you to react quickly. So for example, when you're driving, a car in front suddenly stopped, so as a response you slammed on the brakes. So as you can observe, you may experience an increase in blood pressure and heart rate. You feel trembled and etc. at that time. These responses are normal, but a pheochromocytoma causes more of these hormones to be released and causes them to be released even if you are not in a threatening situation. Signs and symptoms of pheochromocytoma often include palpitations, hypertension, and excessive sweating. Other than that, we have headache, tremors, paleness in the face, shortness of breath, panic attack type symptoms, weakness, and less common symptoms may include anxiety or sense of doom, constipation, and weight loss. So the aforementioned symptoms may be constant or they may occur or get stronger occasionally. Certain activities or condition can make symptoms worse, such as physical exertion, anxiety or stress, changes in body position, labor and delivery, as well as surgery and anesthesia. Certain medications can make symptoms worse also. This includes monoamines oxidase inhibitors such as phenylzine, tranylcypromine, and isocarboxazid, as well as stimulants such as amphetamines or cocaine. According to literatures, about 30% of cases seems to run in families. These are more likely to be cancerous than ones that appear at random. The tumors are more common in people who have disorders or conditions that are passed down from their parents to their children, including multiple endocrine neoplasia type 2, von Hippel-Lindau disease, neurofibromatosis 1, and hereditary paraganglioma syndrome. A surgery to remove the tumor is the common treatment for pheochromocytoma. Your doctor may be able to do this using tiny cuts instead of one large opening, and this is called laparoscopic or minimally invasive surgery. Before the surgery, you may need to take a medication to lower your blood pressure and control an occasional fast heart rate. If you have a tumor in only one adrenal gland, your doctor will probably remove that whole gland, and the other gland will make the hormones your body needs. If you have tumors in both glands, your surgeon may remove just the tumors and leave part of the glands. If your tumor is cancerous, you may also have radiation, chemotherapy, or targeted therapy to help keep it from growing. So there you go, another episode is done, and see you again next week.
Next week's episode of Rheg Explains.